Hi everyone. My name's Sophie. I'm from the Lambeth Early Action Partnership, and I'm going to speak a bit today about one of the services that LEAP funds in Lambeth called the Community Activity and Nutrition Programme, and present some findings from an analysis that I did showing that participation in this service is helping pregnant women and birthing people with a BMI over 25 to increase their physical activity levels. So a little bit about LEAP to start off with. So the Lambeth Early Action Partnership is one of 5 sites receiving funding from the National Lottery over a 10-year period, aiming to improve child development outcomes for early years children and their families. So LEAP funds over 20 different services in a sort of area in Lambeth, as well as having a programme of capital improvement works to local children's centres and workforce skills development. And our services cover a really broad range of outcomes and target different people, including pregnant women and birthing people, children aged 0 to 3 and their families. And priority is given to families from more deprived neighbourhoods and from ethnic minorities. So the Community Activity and Nutrition Programme is one of our longest running services. It's sort of emerged from a randomised control trial that was run about 8 or 9 years ago, I think. And it responds to a kind of specific need within the LEAP area. So we know that maternal obesity is a risk factor for complications in pregnancy, including gestational diabetes, high birth weight, and obstetric problems, which is not only problematic for the pregnant person, but also for children's long-term outcomes. And within the LEAP area, in 2017-18, 41% of women looking for maternity services had a BMI of 25 or over. So we sort of know that this is an area where improvements can be made. The programme itself is an 8-week programme. Women are identified when they book with maternity services and invited to take part if they're eligible, and they get 3 appointments with a midwife at registration, which is around 14 weeks pregnant, at the end of the programme at around 28 weeks, and then a 6-month follow-up postnatally. And then the sort of core of the service is the 8 sessions that they have with a health improvement facilitator. And the service is designed to be quite bespoke. Kind of the focus is on empowering people to recognise the changes that they can make within their own lives, rather than kind of a focus on weight management, losing weight and things like that. And there's a focus on, improving both eating and activity levels. So we have data on physical activity at those 3 time points that I mentioned, where they have the midwife appointment, and we have data from 485 participants. The tool that's used is the International Physical Activity Questionnaire, which asks about frequency of different types of activity during the past week. And I conducted a multi-level mixed effects regression in Stata, adjusting for ethnicity and neighbourhood deprivation to investigate the effect of investigate changes over time. There are some limitations to the analysis, so obviously it's a self-reported measure, so there's sort of the possibility of response bias. There's loss to follow-up over time, particularly for the 6-month postnatal time point. Although, follow-up between 14 weeks and 28 weeks is quite good. We don't have a counterfactual, and so, it's sort of worth noting that obviously this is a time of great change for participants. They're going through pregnancy and then they're giving birth. So, that's just sort of a caveat to bear in mind. That being said, I think we do see some really positive results from the programme. So this chart shows the results from the regression model showing the minutes in different, the two different types of activity per week. So you've got the yellow line showing walking and the sort of red-orange line showing moderate and vigorous activity. And what we see is a significant increase in walking over the course of the programme. And this change is actually sustained postnatally. We don't see any change in moderate or vigorous activity between registration and 28 weeks, which may be unsurprising given that this is a point at which women are becoming more heavily pregnant. We do see an uptick at the 6-month postnatal mark, but again, we're sort of a bit cautious about attributing that to the service, given that that's quite a long time frame, and women have kind of given birth in that interval. So yeah, just sort of summarising, the increase in walking that we see is equivalent to around an hour and a half of additional walking per week, and this is sustained at around an hour and 20 minutes extra. And yeah, I've sort of said around the no antenatal change in moderate or vigorous activity. And when we look at the likelihood of meeting the minimum level of activity recommended, we see that participants in CAN are much more likely to be meeting that threshold. So it's sort of from a public health perspective really positive, and hopefully kind of has those kind of knock-on effects on both the mother's health and the child's health. We also looked at differences by ethnicity. So the LEAP area is very ethnically diverse, and the participants in the CAN programme sort of no exception. So around just over half of participants are of Black ethnicity, around a quarter of white ethnicity, 12% other, 6% Asian, and 4% mixed. And we do see significant differences in activity levels by ethnicity. So at the start of the programme, participants of Black ethnicity spent the least time in physical activity, and white participants spent the most, equivalent to around an hour a week spent walking, and around half an hour in moderate or vigorous activity. This echoes findings from national surveys, which frequently find similar findings. Possible reasons are things like access to space for exercise, experiences of discrimination when sort of accessing those spaces, cultural differences, and also potentially differences in parity or family size that mean that people face different opportunity costs. We do see that activity levels increase for all participants, which is great. There's no change in the gap. So at the end of the service, we're still seeing that gap by ethnicity. It's kind of positive that the service is managing to achieve kind of positive outcomes for everyone. So in conclusion, individuals participating in this service managed to significantly increase their physical activity levels during pregnancy and beyond. We do see differences by ethnicity sort of over the course of the programme, but we do also see positive change for all groups. And it's worth mentioning that, the feedback that we get from participants is that they really appreciate the sort of tailored and non-judgmental approach, and that they find that sort of, it's very empowering, and it's often quite a different experience for participants to what they've been used to in terms of conversations about their weight. And we think that that's sort of quite an important part of the service and how it's achieving outcomes for women and pregnant people. Okay, so thanks for listening. You can use the QR code if you'd like to read a little bit more about the analysis. And there's some links there if you want to find out more either about the specific analysis or about the programme. So thank you very much.
Thank you very much. We've got time for probably one or two quick questions if anybody has them.
I'm just kind of interested to the parent to a extreme preterm baby, previously it's now well can't be. Has been any kind of analysis of the outcomes for the children after birth?
Not currently, but yeah, we are planning because birth weight is sort of another important outcome. So yeah, there are plans to hopefully look at birth weight at some point. And possibly kind of mode of delivery and preterm birth would be a really interesting outcome as well.